always want you to understand is I don't expect for you to get it this first time out, this is the first time you're seeing it. But what I do expect for you to do is for you to take some nuggets from each one of these steps and how you can apply it to what you're doing currently at your program. Because what it's going to do, it's going to align your program in such a way that it provides a systemic process, okay, more than anything else. And the more you get it, the more you take it, the more you look at this, the more you have a better chance of getting it, okay? All right, let's me pull up the PowerPoint. All righty here. Definitely want to again thank you all for being part of today. This is, as you know, this is part of an awesome campaign, which I'm always delighted to, to see it come to fruition, because it has, in my work across the country, I have yet to see a county really take on such a unique strategy to impact that. And our partners in Better Ways to Cope is the one and only, none other than Rashida Jackson Butler. And she runs the RBJ Community Consulting Company, an awesome organization that I know it's going to be helpful for you if you've been taking our trainings. I already know that. And then, of course, our organization, TTJ and Charades and Associates, and then, of course, the Two Story Creative Agency. And they've been a part of this, helping to put together sort of that marketing, if you will, of the awesome stuff you all are doing. But in addition to that, some of the great stuff that can help the overall project take place. I want to congratulate, as you see on the screen, those funded agencies who have received or are receiving resources to be the first to implement Better Ways to Cope through the Milwaukee County Department of Health and Human Services, the Behavioral Health Services Division. I don't think Jeremy's on, but I definitely want to thank Jeremy Triblett, who sort of is that project coordinator of Better Ways to Cope and how he's putting things in place. He undoubtedly is bringing a new opportunity for organizations in the Milwaukee County, and I'm really excited about that part as well for what they're doing. So thank you, Jeremy. As I said, today is Strategic Prevention Framework Part 2. And what I wanted to do today is first review what we went over, and then secondly, get into the planning, implementation, and evaluation. Okay. The company that I'm representing today is TTJ Group, and we're part of an organization that really believes in that building, communities that one neighborhood at a time. We really put our efforts into this work in terms of how we do. We do it in so many different facets. We utilize what we call the 5 pillars of capacity building: passion, process, power-based, prestige, and presence as some of the key elements that we've learned that organizations that really do well and do have effectiveness in their work have these 5 key pieces working on a consistent basis. Today, what I want to do is just to do some virtual training housekeeping, since we are moving to part 2. If you don't mind, record your name on the chat, what organization you're with, especially that, whatever device that you're using. If you can, like Sister Bernadette, have your cameras on. Love to see your faces, to get involved. You can, I understand, whenever possible. We know with this the Zoom world, we know people have to get off and get on so many different ways. So we appreciate that. Remain on mute when you have the opportunity, unless you have something, which I hope you do have something to say, and have an opportunity to express yourself during this day. And I really want you to feel like you can participate, and in a way that's useful and provides you with that opportunity to do so. So, and then finally, we got an evaluation. And we want to know, if this was helpful, if it wasn't, why, if it was helpful, why, because it helps us build on to some other opportunities that we see beneficial to what you're doing and what you're working on. So the one thing that this is all about, this part one last 2 weeks ago, this part two was to look at the strategic prevention framework. And what I told you all is that it comes from your own federal tax dollars at work. It comes through the U.S. Department of Health and Human Services, Substance Abuse Mental Health Services Administration, or people know it as, some people call it SAMHSA, which is the letters, but it's the Substance Abuse Mental Health Services Administration. They are charged with doing prevention and treatment and mental health for the entire country. They do also, they do funding around that work. So if you haven't had a chance to go to their website, make sure you write down SAMHSA, SAMHSA, SAMHSA.gov. And when you get a chance, freely go to their site, not to just look for the funding, but look at the things that they can offer to you, because most of the stuff on there is free. Why? It's because your tax dollars that you're using, that you're paying for every April or before April, when you pay those taxes, those dollars are going towards organizations like SAMHSA to provide the best services to us as Americans in our communities. And I used to work there. Before that, I ran a nonprofit in Illinois, in Freeport, Illinois, where it was called Martin Luther King Jr. Community Services. We used SAMHSA. I learned about SAMHSA, learned what they provided to us. I learned about their resources, learned about their grant writing out the grants that they provide. We received one of the grants back when I was there. I wrote one of them. And then I left and went to work for them in 2003, and started working for them as the director of training and the director of technical assistance, where I oversaw 10 states. I was in charge of 10 states providing this kind of training, and my team was this kind of training to those 10 states, including Wisconsin, about what is prevention, or we created the strategic prevention framework. Why is that important? We trained our state systems, we trained county systems, and so this is something that our team did in those 10 states, and those 7 Native American sites, including in Wisconsin, the Great Lakes Intertribal Council, and those groups in the state of Wisconsin as well. I want to thank my staff, Tasha Wilkinson, Director of Administration and Training, and I also want to thank my program manager, and Sheree's TTJ, behind the scenes individual, Latisha, we call her Happy, Latisha Askew, and because they've been a part of this and they've been helping to do this. So if you have any concerns on your webinar, just you see Latisha Happy has Sheree's TTJ group, you can just email me, chat with her directly, or if you have any questions, you can also chat with me or Tasha as well. So we thank you for this opportunity, and we'll move on. So one of the things we talked about last time, for those of you who were here, we talked about this important kind of sort of model, not a model, but a process. And when I was at SAMHSA, we created this process to really build upon helping state systems, community systems, county systems, local systems, to really help their organizations that are working to do prevention work, in their communities, and to give them a framework of doing that. We dubbed it the Strategic Prevention Framework process. And what we tried to do is that we tried to ensure that it was a simplified process that people can understand, that folks can utilize, and it always is a changing thing. So it's not a cut and dry, because when this first came out, it was a different linear thing. but you've seen a change to where it has more a cyclical circle process with some interchanging interwovenness in it, and that it's all sort of connected in the middle. And it's connected in the middle because it has what? Sustainability and cultural competence. So what it's saying is those two things in the middle should be a part of each one of the 5 that you see on the outskirts. And those 5 that we see on the outskirts of the flower or the process, they're all interconnected. So it is not linear. You can't just go to assessment and then stop, then go on to the next one. If you need to go back to do an assessment before you go to capacity building, the idea was that was the purpose. Okay? All right. So for those of you who are here, here's a quick question. Those of you who were here 2 weeks ago and you had any questions or comments, we went over assessment, we went over capacity. Is there any comments you want to put in the chat or question? Or are there any comments that you want to bring up about the actual training that you want to talk about? Either using the mic, opening your mic up, or putting in the chat. And don't forget to put your organization's name in the chat as well. I'll give you a minute to think about that. If you have anything you wanted to add about the last 2 things we went over. Thank you, Tasha, happy for putting the SAMHSA.gov website on the chat. That's good to see. So, seeing there's none, let's move on. I don't see if unless somebody want to unmute their mic and have any thoughts. Okay, good. So, we talked about assessment, and what we said was, hey, one of the things about assessment is this is before you even think about implementing something. You want to collect the data of your targeted area. Like it says there, you want to put together a profile so you know what you're working with. Profile what the needs are, what resources already exist, who's already doing what. Is the readiness scale of the folks that you're going to serve? What's the level of readiness? Because if you want to just walk in and do a program and they're not quite ready yet, right? Then what you could have is sort of a meltdown because, people are, your targeted area is not ready, but you want to implement your program because you got funding to do so. And that's not always the most important thing to do, right? So doing the assessment is the key part of starting the framework out. And that the process that you learned that really worked well when you did the assessment, that's what you want to sustain. That's what you want to keep. That's why sustainability is connected to that one. Because you want to say, oh, we did this. We got the right people who gave us the data. They gave us even some more data. We found some other places to get data, and they were helpful in giving us that data. Good. We're going to sustain that when it's time to do another assessment of the data. Because you may do the assessment, but that only may be good enough for 2 or 3 years. So you want to always sort of think about doing data assessment on a consistent basis, right? Because that really ensures that what you're trying to attack is really still there, or has the target moved at all, right? Because if the target's moved, you'll know by what the data says before you start implementing anything new. That'll tell you if the things have changed, right? So that's why coming back to assessment, every 2 or 3 years to measure the level, get a profile of your target area, always gives you an understanding of why it's important. And I always use my physician. If my physician went off of what he or she knew about me 7 years ago and didn't always do an assessment of me every so often, then he or she would be working on me based upon that assessment that he did of me 7 years ago. And we don't want that. I want him to do an assessment of that, of me lately, as of lately. That's why assessment is so important, because as you think what you're doing is working, it may not be what the community is ready for. So knowing what the community is ready for and a sense of readiness is important. But also as you look at what the data says, right, of your community, the other thing is, who's doing what to deal with that problem right now? Who's making any strides? Who else we need to bring to the table to be a part of this? Because we know when we created this framework that it could not be done with an agency all by itself, that you have to have collaborative partners. And I'm not as much worried about Milwaukee as I do other communities, because I know you guys don't fight over turf. So I know that don't exist. But bringing people to the table as a part of the capacity level to help mobilize and address whatever you decide to address is so critical based upon the needs of the target area, right? So having those two things really helps sort of say, okay, we know what the data says, we know what's going on with the 300 students and what the data is saying, but now we got to identify, who else we bring to the table to help us do that? Who else could really help provide the implements of this next step? That's also a piece of our capacity, right? So that actually leads us into where we are today. And that is around planning, And so when you think about this process that you're learning about 2 weeks ago and today, it's really a dynamic planning process that you can start utilizing within your organization. Through the data, through the capacity. Oh, wait, before you even implement, let's really lay out what we call planning or a plan, a process, right? That's what helps this process out. We want to lay out a planning process, because you got the data, right, from assessment. You know who's doing what, and who wants to be involved. That's from capacity, right? So now we want to make sure that you understand what that means. So as it relates to this section of the presentation, we want you to be able to define the components of planning using data. We're going to talk about that. But I also want to hopefully have you all, by the end of this particular section of the training, explain what a logic model is and its results and outcomes. Okay, because that's so critical, is that you may have and define the planning parts, but when it's time to actually implement and do it, it's so critical that they're part of the team as well. Okay? Any questions to this point? Oh, and finally, of course, we always want to discuss the cultural competence and as it relates to planning. As we've seen in that previous circle there, we always not only want to deal with sustainability at all five, but we want to know were we culturally inclusive and culturally engaging in both getting the data and making sure the right partners are at the table that may ultimately affect certain types of populations that we don't have the true expertise to do it. Okay? So that's why this planning process is critical, because it gets you before it's time to implement. This is just planning it out. But I know, Mr. Johnson, I'm ready to get started. I want to do this implementation thing. I ain't got time for all that unnecessary. I think I know about my community. Well, let's just say you go to the physician, and the physician for the first time is seeing you, and he or she automatically tell you, we're going to do this, this, and this. And you're going to look at the doctor and say, you ain't figured out what's wrong with me yet. Exactly. And that's why this process is critical too. Because when you do this process, you actually become the physicians of your community. You become the physicians of your community. By doing the assessment, by looking at the capacity, who's not there, who's there, then you can plan what needs to be done with those planning partners, with that capacity group that you brought to the table. Because y'all collectively will plan and say, you take this part, we'll do this will be our goal to do this. You begin to plan out before you really implement. Okay? Any questions for anyone at this point? Okay, so planning is the third part. And that It's really important that we understand that. Why? Because what we're doing is we're doing the planning based on what it's out there, what the data says, and you can get it all kind of ways as this slide shows you, right? You can get it through opinions, you can get it through focus group, you can do interviews, you can do the real formal stuff, qualitative research. You can get it by just talking to people, marketing people, getting surveys, getting ideas. But that's data collection. So as you're planning, you're thinking about the data that you received from the assessment process, from the very beginning of the step, right? And so you're thinking about, okay, we got to plan around what we thought was identified in the data. So we've got to do some decisions at this step before our group implements. We got to do some decisions at this point. I'm curious, how many of you that are on this phone, how many of you have actually done some strategic planning for your organization? If you have, put it in the chat, put yes or no in the chat. If you've done strategic planning in the last 3 years, just put yes or no in the chat. Thanks, Sister Bernadette. Appreciate that. Okay, Hetty, thank you, Hetty. I hope you're saying your name right. Am I saying it right? Hetty, can you unmute yourself and make sure I'm saying it correctly?
Yes, you're saying it correctly, Hetty.
All right. Thank you, Hetty. I appreciate it. And you said no, you haven't done it in a while, in 3 years or so. Okay.
We're looking at it now.
Oh, good.
Getting help with it now. Mm-hmm.
Good. That's important. That's important. Anyone else please make sure you put on there if you have done any strategic planning, just put yes or no within the last 3 years with the organization that you're working with. I would love to hear from Quenisha. Would love to hear from Clarence. Thanks, Brother Jeremy. Hello, sir. So, one of the things we do know is that doing strategic planning from the data framework is really important. And using the data as we do the strategic planning is very important. Because when we develop a comprehensive planning process, and it's based on all the data that you collected. It's based on the surveys that you got, the feedback that you got from people, some of the written data about what's going on in your targeted area. It's based on that, y'all. So it's based on that, but it's an array of appropriate. You want to really look at maybe a whole group of evidence-based things that work. You want to look at things like an environmental strategy or broad-based population, sort of maybe marketing, maybe communication strategies or something like that. We call them in this business environmental strategies. Or you might want to maybe develop a plan around doing what many of us are so used to doing called direct strategies, where we actually have the after school tutoring program, or we have the youth mentoring program, and we're doing direct prevention type services. Or maybe in our plan, we might want to do indirect, which means we're not actually doing it for the kids who are coming to the program, but maybe we're doing some sort of training to them, or maybe we're doing, and then they do the program. Maybe we're working with the young folks who want to mentor the younger folks, and we're just working with them to get them ready to do that kind of work for them. That's indirect prevention strategy. But we also know that when you're doing that comprehensive prevention strategy, y'all, there is some flow chart or mapping out, if you will, of how you're going to do it and why you're going to do what you're doing, even before you do it. We call that logic models in our business, but it's really a flow chart and why you're doing what you're doing, right? So creating that comprehensive plan is really, really critical for you all to move forward and move in a way that's beneficial. Any questions so far? Any comments so far? Please put them in the chat. I do want to ask you all, for those of you who have done strategic planning, what year are you in? So, Brother Clarence, what year are you in? Or what year are you in your plans? If you said yes.
I'm sorry, Tracy. I was actually responding back to Jeremy.
Oh, okay, no problem, no problem. I was just asking what year in the plan? You said you have done strategic planning over the past 3 years. What year are you as your organization in implementing that plan?
Well, I know that Jeremy, he's been doing it since he's been here, but me myself, I don't have a lot of experience with it. I would say, yeah, just a couple months, if that.
Okay, very good. Very good. Sister Bernadette, you said yes. What year are you in your plan?
We're on 2023, and we've been in business for a long time. So
okay, so it's been a couple of years already. You think?
No. As far as planning, we've been planning for quite a few years.
Oh, okay.
Years. And when you were asking, I guess I took when you asked me what year were we on. I guess we're up to 2023. Thinking about putting together what we're doing for that year up until that year. That's why I answered my question.
Okay. I'm sorry. Yes. That makes sense. Okay. All right. Anyone else?
Yeah, hey Tracy, we've been so we do something every 2 or 3 years where we create a department-wide plan, an improvement process where we take a look at our goals related to staff, competencies and supports related to community engagement, things of that nature. And we say to ourselves, well, based off the data and the work that we're doing and the needs, where should we go for the next 2 or 3 years? After we do that, we always check into it. So we're actually at that place now where we're checking in on that and just identify what we've actually accomplished. But that's an internal plan.
Sure.
When we talk about strategic planning for community, we're in that phase. We have been in that phase to figure out, for example, we want to increase people's access to things like fentanyl test strips and things like nasal Narcan and all of that kind of stuff. And so what we've identified as a strategy folks have been using is placing vending machines across the county. So we've purchased 20 vending machines, and we're planning out where to put those, and then how to increase folks' engagement with those supplies at the vending machine. And so for us, we're right at that stage where we found the data. The data tells us which zip codes actually have the highest fatal and non-fatal overdoses. So that's important. Now we want to drill down into each zip code and figure out which businesses want to host a vending machine. And then once we have all of them placed, we want to measure certain things. I was just talking about it today. We want to measure the percentage of vending machine supplies that are being taken each month. Then we're thinking about doing like a quarterly survey to figure out how many community members utilize the actual supplies in there. So like, for example, across the 7 zip codes we currently look at, there's 110,000 residents that live in each zip code that are people of color particularly, right? So because we're trying to make sure it's equitable and we're trying to reach vulnerable communities, we figured we zoom in on that population of people as well. But there's, so folks of color are about 43% of the total population of people who have been impacted by the pandemic, right? And so one of the goals we'll have is to get that survey to figure out how many folks are actually increasing the amount of supplies they use from vending machines as well. So, for us, that strategic planning begins with data, data that's actually accessible to the entire county. Anybody on this call can use it. But then it also thinks about using the data to figure out the strategy, and then measuring the impact of that strategy.
That's right. Measuring. You really have thank you, Jeremy. You really have just taken us through what I'll be talking about over this next hour and a half or so. in terms of what you all are doing at the county level. It's a great example for you all to take of what you can do or starting to do, because I want you all to, you can put the plan in writing, but if you don't start implementing it and actually using it to begin to make substantive change based upon what you're doing, then it's really not any good to your organization. So having that plan completed, then beginning to implement that plan over a period of time is so important. So thank you, Jeremy, for that, and we appreciate that.
I want to just say too, it's not in such details as Jeremy, but yeah, over the last few years, especially with the COVID coming in and everything, we had to take a new look at, okay, how do we present this to the people in the community? So we did that, and now that we're coming out of it, and now we're back sitting down now again, trying to see how do we implement everything now that things are opening up. So that's kind of been a little challenge in my mind.
Yeah.
You know, okay, how do we go forth with this? So we're planning right now too. That as I stated,
Good.
23. So
Good. That's good to hear. That's really good to hear. And that was a challenge. And
yeah,
you're doing, and what you're doing now, and any of us who have done any planning, you know, doing a plan right now, doing a doing pandemic is a tough thing.
you know what
And
though, but really believe it or not, during the COVID time, we did good. We did great. Continue to work on now. Like I say, the to me, and it's a challenge to me, is to in my mind right now, I'm talking to people trying to figure out how do we do this. The challenge right now is getting back out there, trying to see, you know, where do we go, how do we go, who's touching who's coming together. So that's the challenge right now. Do you want to go here? Do you want to go there? That's the challenge now of now going back out there and facing everything that's out there.
Yeah, what people want to do, what they
But
want
the COVID time, it was fine. Our sessions, we did Zoomed our sessions, that was fine, and everything else that was fine. But now the challenge is, okay, things are opening back up. Like Jeremy said, he going all these different places. I'm trying to think in my mind, do I want to go all these different places? So it's a challenge for me personally to get back out there to do what I need to do for the community. See,
Yeah,
so
and I think as you do your personal review, Sister Bernadette.
I'm sorry.
You know, as you complete, you looking at it personally, what's a challenge for you? You might want to ask the same questions of your targeted audience. Is this still a challenge for them? You know, by doing a survey or having them when they come on something like this, when you're doing something with them, maybe online, you say, hey, I got a quick survey for you at the end. And maybe the survey may write out some quick answers for them that you can use to say, maybe it's a challenge for your people that you're serving too. And so what does that mean for you? So you can see if it's a personal challenge as well as a client or a targeted area challenge as well. And then that helps you strategize your team to strategize what direction to take as well. Okay.
Right. Thank you.
Yes, ma'am. So goals and objectives are important to the plan. Are we going to use direct? Are we going to do indirect? And then how do we measure it? Even though I put the word evaluation, I don't want you all to get stuck on that word. Just really what I want you to do is, how do you measure your accomplishments, or even measure things that may be a barrier? What caused it? Why did this happen? And then also creating, a written conclusions and what's next, a recommendation. And so when I had my organization that I was working for, Martin Luther King Community Services in Freeport, Illinois, one of the things when we created our goals and objectives and our direct service, our indirect service, we had to say, okay, how do we measure that what we're doing is really working? Why? Because we was able to take that measurement plan or evaluation that you see there and create, some recommendations for opportunity for funding. So the unique part about the strategic prevention planning phase of this is that it really helps you go back to your assessment and say, what really, we had a list of things that we call risk factors or contributing factors. In my community, one of the contributing factors was low academic scores. And that's why kids were getting involved. Another thing was there was no adult parental support after a certain time in the day. Another contributing factor was, there was no ID check for alcohol, so folks can get that. So we had several, we looked at all those, what were those contributing factors? And we then had to say, we had to prioritize. And we're going to talk about that in a few minutes. You have to prioritize which ones you really going to work on, because you can't work on them all, but you have to identify and prioritize which ones are best to work on. Then you have to select the way you want to approach it. Is it in our business, and we talk about prevention or mental health and substance misuse, we talk about, is there evidence behind what you want to approach and work? And, is it evidence behind doing an after-school tutoring program? Is it evidence behind doing a mentoring program? And if so, what is that evidence? So what this is asking you to do, and what it asked us to do, was, okay, I know you're ready to implement, but just make sure what you're implementing, there is something behind this that is showing evidence. So in our plan, we had to really take time and identify what approaches we want to use if there's something that shows that can work. And then from that, you create the flow chart, okay? When I talked about prioritizing earlier, just a few minutes ago, I said you got to decide, you can't do it all. You have to identify which particular factor or risk factor you want to work on. And I always say, ask these questions. If you identify maybe a factor of parents are not at home with their children, is that a factor that has some changeability to it? Can you, if you do something with your work, can you help change that factor? See, the key is any other factors that are risk factors or protective factors in that you have identified in the assessment, you have to ask the question, is it changeable? If we do something, can we actually change that issue? One of the things were kids' academic scores. We had to ask ourselves our question, can we help change academic scores of students if they attend, if we implement a plan? Can we change that? And then we had to ask the question, how important is that factor? Well, if low academic scores was a risk factor, well, how important is it that if we change that one factor, that it may reduce the problem? Okay, so is it changeable and is it important? Those are two things you want to ask when you're prioritizing. Ooh, man, we're going to plan. One of the things that we found out was that kids were having academic problems and that parents were not at home during after school time. And there was another factor that kids were having access to alcohol at the liquor store, and they weren't checking. They can get liquor all the time without getting ID. So if I had to choose two of them or one of them, which one is a changeable one? Which one is an important one? That's what they mean by looking at what you identified in your assessment. Is it changeable and is it important? Changeable, is it important? Okay. And when we talk about what's evidence-based, when you all get a chance to look at this slide, this webinar again, there's several ways to look at this, all kind of evidence-based approaches in everything that you already are doing or may not be doing, but you are doing, but may need to be tweaked to show that it has evidence behind it, okay? You can find them on what we call federal registrars. You can find them at the SAMHSA website. There's these, I have a book somewhere. I wish I would have took it out beforehand. I have a journal. It's a Society of Sociology journal. And in those journals, sometimes they have listing of what works in communities. And so if you see something, an approach in there, then if it's in a journal, that means it has been shown by the folks who reviewed the documents that there is some evidence that works. Okay, that's what they call peer review journals. And so you can go to the library, get those. You can go online and get those, look at those. But in those journals are things that work, y'all. And so you can look at some of those approaches. You got prevention experts that can tell you some evidence-based programs that work. Then you can also go to the Blueprint of Healthy Development at the University of Colorado. Make sure you write that down as well. The Blueprint of Healthy Development at the University of Colorado. You can go online. You can look at all kinds of evidence-based approaches that you might want to put in your plan that you can use. Then, of course, there's SAMHSA's the prevention training technology centers that are available to you at no cost. They have a listing of evidence-based ideas and strategies that work. Then, of course, CDC has these evidence-based interventions, or EBIs or DEBIs, developmental evidence-based interventions. They have these programs listed on their website, y'all, of approaches that work, that you don't have to reinvent the wheel, that there are approaches that work. So that's something I wanted you to know as well. But when we look at what really works, as I said, we got to look at what's causing the problem. So this is a good example. I have to get my car fixed, right? And my car fixed, there's a lot of approaches that the mechanic can use, you know, and the mechanic can just get underneath the hood and see what's going on. Do they have the right tools? Do we have what kind of approach he wants to use? You know, so even in looking at evidence-based programs, you have to sort of get a sense of what you want to use. What are the tools you want to use? Because this mechanic can't just go in there with a hammer and start hammering my motor. You know, the mechanic has to come up with some evidence-based strategies and approaches. You know, I mean, some ideas on what tools he or she wants to use. And what we talk about in looking at evidence-based approaches, what are the tools? Is it just for one child that you're trying to change? Or is it for a broader group of folks you're trying to change? Or if it's for even a broader neighborhood you're trying to change? That's a certain tool that you want, a program you want to look. What programs do you currently have? What other programs that are out there that you might want to use? Is there any kind of other approaches that you think you want to use? What about the policy around that? Hey, when I gave you the example of a problem that was happening, that young people were getting alcohol underage without being carded. Well, what's the policy in the city or the county for that? What policies do we need to change or make sure we make our elected officials aware of if we're going to do some evidence-based approaches? Maybe we want to do something around helping with policy change, right? So that's another area we want to focus on. And then, is it enforceable? Anything that we do, can we enforce it in a way that really works? So, you know, identifying in your plan what evidence-based approaches that are critical is, as I said before, if it's been in one of those federal registries that I listed, is it research that shows that that intervention has been in a peer-reviewed journal? And does it have really documented success working? I don't know about y'all, when I go to the doctor, I just don't take my doctor's word for it. I ask questions. And I want to know what has been the research on you giving me this medicine. And what has it done in the past? Can you give me a name of it so I can do my own research? Because I want to know if I'm going to do this procedure or do this medication, I want to know what the research behind it has said and it really, really worked before I actually put it in my overall plan to make myself healthy. Same thing has to happen in our community. If you create a plan to do some really good work, you want to make sure the plan that you create in one of the projects and the programs that you create has some evidence behind it. And I just wanted to leave you with some questions that I always tell people to think about when they're creating that, when they're looking at a good prevention strategy. I always say, hey, ask these questions. How would the selected strategy address the earlier contributing factors that I identified in my assessment? Will they really impact those factors? Is the programs that we use, and are they going to be evidence-based? And then what other programs exist around my community? Okay, I'm doing that capacity thing. Hey, maybe the YMCA, maybe the Boys and Girls Club, maybe another community-based agency, maybe COA or somebody is doing this already, and maybe I can get them to be a part of this project that can help me address these identified problems. And then another program, a question I always say, what I identify in my plan, will it achieve what I expect in my desired outcomes? If you all remember what I said what outcomes was, it was a change in knowledge, change in attitudes, and change in behavior. So will I see a change in knowledge? Will I see a change in attitude? Or will I see a change in behavior? So really identifying and selecting strategies for your plan is so important because this is what you're going to implement once you're ready, once you get your plan done. You have to ask yourself the question: is it effective? Does it impact my population? Do I have the right climate to implement this program? Are there resources in my community who can help me implement that? You heard Jeremy give a great example. Is one of the plans to put the things in the vending machine was to find organizations where the vending machines can go. So they're looking at resources already out there to put the vending machines out there. And then one of the things about identifying good strategies is they're going to be sustainable. In other words, when we created our after-school tutoring program in our plan, we wrote in there that after so many years, and if it was successful, we would turn it over to the school district, that it can sustain itself, not because we want to keep getting money, but we want to keep impacting those young folks, and we can move on to something else in a new plan. So we asked ourselves the question, how do we sustain an effective program that has good outcomes, changes in knowledge, attitude, or behavior, and how do we move that forward? Okay? So when we talk about looking at our strategy for our plan, and I'm giving you an example of substance misuse, but you can put behavioral health in front of it, or whatever words you want to use, you can look at things like education and awareness. Those are some good strategies. You can look at, maybe we just want to marketing. We've got a great partner with us, a two-story marketing group. That's another way to do a good substance misuse strategy, right? And then maybe we want to actually do some good prevention program that sort of looks at the issues that we're trying to deal with. I don't want you to just dig into this even when you have this slide and you get to look at it again, but I want you to look at the bottom words that I thought was really important when you're trying to create what I call the right fit in your plan. You want to put a good program and it's the right fit for based upon your data. You look at these things. Is it relevant? Is it relevant to what you're trying to impact? The second thing is in the middle. Is it appropriate? Is it appropriate to what you're trying to accomplish? Does the program or the strategy that you're going to do, is it appropriate for the targeted population? Okay? And then the third thing and final thing is this. Is it effective? As it demonstrated. If you can answer yes to relevant, yes, it's relevant to my targeted population. So in other words, if I'm doing an after-school tutoring program, but then I find a senior program that's for the seniors, is it relevant to my after-school tutoring program? No. If I find a program where seniors work with youth and helping them with their homework, it's relevant. Okay? So that's a strategy that I want to put in my plan as one of the things I want to do because it's relevant to what I'm trying to accomplish to impact that. Remember that assessment that I had. Then the next question is it appropriate? If I find a program that's working with high schoolers, but my target group is middle school and grade school, is the strategy appropriate? If it's not appropriate, then we don't use it. So if I do find a program that works with 11, 12 grade school, middle school children, and it has high school children doing the mentoring of them in that program, it's appropriate, right? And then if I find a program that's effective, I can go back and see what was written about doing after-school tutoring programs. Go online and go to those sites I gave you earlier and find an after-school tutoring program that says, oh, yes, you do it these ways. What we found out in doing our after-school program was keeping a ratio of no higher than 7-to-1. Every 7 students to 1 teacher or 1 teacher aide. So if we had a teacher and a teacher aide in the after-school program, we would have only 14 students. Because we knew that based upon what we learned, the evidence shows that once you go higher, then you decrease the evidence of effectiveness. And you don't want to do that in your program. just to try. You want to do it effectively. It's like the doctor tell you, when you take your medicine, take one in the morning, take one in the evening, or take one in the morning after dinner, after breakfast. And then you end up taking it in the evening, then you're going to think it's effective, and you're going to wonder why it's not working. Same thing has to happen with identifying your programs. So when you identify your program, you put in your plan, you want to make sure that there's the best fit for it, right? Okay. Any questions on that so far? You also may want to implement what I call environmental strategies. I gave you the definition earlier. You want to look at things like community norms. What are the norms of the community? I seen yesterday one of the norms in Milwaukee. They were marching about voting. I seen some ideas, like a huge march going on in Milwaukee. I watched it on the news, so those are the norms of the community. Also, so when we look at good environmental strategy approach, we look at community norms. We look at access and the availability of that. We look at media and marketing. We look at policy. We look at enforcement. Those are 5 critical areas if you want to do what we call population level change or environmental strategy. One of the great examples of environmental strategy is that when you get into your car, what do you do before you drive off? Anyone, open up your mic and tell me. What do you do before you drive off and get in your car? Anyone.
Check my mirrors.
And then what do you do after that?
Throw on the seatbelt.
Ding, 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 ding. Throw on your seatbelt. You know how long it took people to start using seatbelts, but the environmental strategy approach implemented over time allowed us to make changes on the putting on the seatbelt. What are some other examples of environmental strategy you can think of that we've done in our world, in our life? Can anybody think of anything else? You can either unmute your mic or put it in the chat. One has been seatbelts. Anything else? And I say seatbelts because there's a norm around, if you get in somebody's car now and you don't put on your seatbelt, they look at you like, ain't you gonna buckle up? Right? And what they've done with seatbelts, they've made it available and accessible for not even the driver, but anybody in the whole car, right? So that's an environmental strategy approach. That it's a norm, that they've made it available, and then when y'all remember that one commercial or that one thing you see on billboards about seatbelts? Does anybody remember? It was like click it and what?
That was click it and ticket.
Click it and ticket. That's environmental strategy approach. You can remember it. See how good it was? It makes you remember that's a good environmental strategy approach.
Can I say one thing on that?
Yes, go ahead.
It was click it or ticket, or not and.
Click it or ticket. So there was a policy. That was a policy, right?
Mm-hmm.
And that was a policy, and they were what? Enforce it, right? Isn't that what they were telling you?
Yep.
That if there's a rule now that you have to put on your seatbelt, and if you don't, we will enforce that law.
Yes.
Click it or ticket. That's right. Thank you for clarifying. So what you've seen with seatbelts, that was an environmental strategy approach. So in your plan, you can do all kinds of environmental strategy where you change the community norms, you're offering access and availability to help that strategy out. You can do some marketing and media that's really happening even with this project that we're on right now. Policy, you can do some laws and changes in laws. And then you can, if you need to, you have to enforce some of those things. Any other, I know of one right now that's happening, an environmental strategy that's happening right now, but hasn't yet caught full of those five areas yet. There's starting to be a community norm change. There is some marketing around it. And that's when we drive and what? What do we do with our phones? Some people do with their phones and they're driving. Yeah, right. That's right. Texting. So you're starting to see a whole new move about don't do that. We want to change community norms. We want to make sure that we want to have access and availability that people stop doing that. So we somehow the phone's going to start seeing now they're gonna start making phones that if they know you're moving at a certain mileage rate, you won't be able to text. You watch. They're gonna change that to help do that issue. Marketing and media, even those signs on the highways, I see don't text now or something like that, you know? You see that on there. You see there's gonna be policies now. Sometimes in some states, in some communities, if you're texting and driving, they're gonna enforce and give you a ticket, right? So that's an environmental strategy approach that has been useful and very helpful to what you can do. So I wanted to give you that example. So good planning, when you're developing that plan, I will tell you this, if you're not using an outside facilitator, then you're not doing planning. Because an outside facilitator allows you to be involved as a participant and not as a person that's leading the group. So if you're doing any kind of planning, bring someone from the outside to facilitate the process. And if you can, maybe task a small group to help draft an initial plan. Maybe you ask for feedback from key people that you are partnering with or doing a service with or having funding from. And they can give you feedback about who you are as an organization. And then you want to keep any of your partners, any of your members, anybody you're involved with in the loop on how your plan is going, because you asked them to participate, but now you got to keep them involved in your plan. 4 critical areas in developing your plan. Okay? But when you also develop your plan, you want to think about what I call a process map. The formal word is a logic model, but I call it a process map to make it simple. It's just a process. You learn how to do it, because why? It helps you develop an understanding. It helps you monitor where you are. It gives you a sense of how we're measuring what we're doing. How do we know? How do we make sure we measure where we're trying to go? It really keeps us from over-promising. And what I did when I had my organization back in 91, we created a logic model. And I thought it was stupid at first. But the logic model kept us focused on our overall plan as an organization. And what happens was you get people that come to you and they see you doing some really good work. And they'll come up to you, like one guy came up to me and said, well, why don't you do something for seniors too? I think that's a great idea, but I have to look at my logic model. And if it's not on my logic model, I can't do it because it keeps me focused on my plan. And that's why it says it helps you from restraining from over-promising. And a good flow chart or a logic model really helps you promote how to communicate what you're trying to get done as an organization. It really keeps you focused. I always say good process maps ask if-then questions, or you have if-then statements. We have the resources needed to do our program, okay? If you have the resources to do them, then you can accomplish what you need to plan out. What's going to be the activities. If you have your activities, then you can deliver the level of service for that activity that is expected to be delivered. If it's expected to deliver, you're supposed to do this activity for 100 kids and you're only getting 5, then that's an issue. So if you have planned, you got the resources, you got the planned activities, and that will bring so many people in, and you start delivering how you're supposed to deliver, then if you deliver what you're supposed to deliver the way it's supposed to be delivered, then your participants who are coming to it will benefit in a certain way. That's the outcome, right? That's the outcome. And if they benefit from a certain way, then what happens is you start seeing changes in that group or the individual to take place. I call it the flow chart if-then process. You got the resources that you need to operate. You know what you're going to do. You know the activity. Then if you know the planned activity, then you're going to deliver on how that activity is supposed to be laid out. And if you do it that way, then your participants will benefit from the way you truly implement it based upon the research and what the data says would be to implement. And then you start seeing changes. That's my if-then, what I call my if-then easy way flow chart to doing it. Anybody got any questions on this? Okay?
No, I
This
think
is a, go
one
ahead.
question that I had was when you talk about, I love this piece, and will you send this to everybody in a handout or something like that?
Yes, yes. Tasha, can we send that in a handout? Okay,
One of
good.
the things that is difficult about doing this is what I've learned the hard way is doing it by yourself.
Yes,
And
yes.
so if you have people, even if it's like, having at least other people to look it over with or doing it with 2 or 3 other people, putting your minds together, doing it in a team base, finding some partners you could do this with, figuring out how to do this within a group setting can make it feel less cumbersome. But also there's people who can think about stuff that you just ain't thought about, right? Because one of the issues is, especially when we fund organizations, we already know that what you're submitting for is almost like in a perfect world, here's the thing, here's what we'll do with your money, right?
Mhm.
And then as the project starts to unfold, there's going to be changes. There's going to be stuff that needs to be updated. There's going to be some things you didn't realize was going to happen. And so that's why it's important to think about this the first time, but make it a living document,
Yes.
right? Allow it to kind of ebb and flow so that it can really help you narrow it in. So doing it in teams, recognizing that some things may change as you go, and then thinking long term about it. One of the things that I think is so important is I'm also learning is that to really uplift um, some projects, you may need more. You may need to do it more than once, right? Or you may need to do it for more than 1 year,
Yes.
right? And so that's important too. If you ever get a chance to do it over or perfect what you're doing, this process helps you take a look back at successes and then plan to increase that success if you do it over again.
Well said, Jeremy. Thank you. And the reason why I want to go back to that is that I said I want to go back to what you reiterate what you just said is that when we're doing this should only happen when you're doing a plan, when you're planning out what you want to accomplish. And it has to be done in a group process, more than one person. That's why you are right, very right. As this slide shows here, that's why we want you, when you're doing good planning, requires more than one person. And as my church pastor leader says, I'm gonna let that settle for a minute. Okay.
Yeah, I
Okay.
just had to reiterate what you were
You
saying there.
did. You
Once
did.
I
I
saw the
appreciate it.
chart, it
Yes.
reminded me, like, yeah, Tracy, that's why I got to do it in the group.
Yeah.
Um,
Yeah.
yeah.
Yeah. That's so important, you all. What we know is that any good planning, real planning, you may have wrote something with yourself. Any really good planning is involved with a broader group of folks, more than yourself. More than yourself. Thank you very much. Here's another one of the logic model examples or the flow chart example. We have a substance misuse and related problem issue. We can go back and forth. We know what contributes to that. What are the issues that's contributing to them? What we call what are the risks? Maybe there's children who are left alone. Maybe there's academic issues. Maybe there's unemployment, and so there's a lack of maybe there's issues of parental engagement. Maybe there's uh, economic issues. Whatever they are, you have to say with those issues. Remember I said, is it relevant? Remember I said, when you identify, you can only focus on those things that are relevant, that you can really impact. And then once you decide what that's going to be in your planning, then you identify what programs, what practices, or what policies that you really want to implement in your plan. And remember, here's some examples of what I call factors that contribute or issues that you want to think about that you found out in your assessment. Maybe in your assessment, you found out in your target area there's unfavorable community norms or there's low parental attitudes towards youth. What contributes to that is that, hey, there's no community education activities around this. So parents ain't getting no opportunity, y'all, to really understand what this issue is around substance misuse. So that's why there's unfavorable community norms around. Or parents don't have conversations about what the consequences are. What you heard Jeremy talk about is what they put in their plan is putting putting vending machines, that's going to increase access and availability. The risk factor is people don't have access to that materials that need to be happening around opioid use, the opioid overdose. So they got to bring it to them in a way that impacts. Same thing happens in your work when you're thinking about impacting your population. What are the risk factors from that data? And then what contributes to that risk factor of that data, right? Here's an example of there's a lot of binge drinking for 18-year-olds, and they're underage, right? So if underage are drinking at an overage binging rate, we know that the problem is that there's a lot of consequence data that's showing kids are being arrested or people have died at the age of 18 and 19 and 20 because they're using alcohol, they're using a lot of alcohol, and they're causing accidents. Or we also see that because they're drinking so much, there's unprotected access, and there's a high rate of STDs and STIs. Well, what's contributing to each of one of those issues, right? And then what are the strategies that we have to impact? So if there is a high young adult unprotected sex and binge drinking, what's contributing to that is that there's these norms around, hey, we always do this, is what everybody do. So let's keep drinking. But what's the strategy around that? Maybe one strategy is to do some media advocacy that drinking causes unprotected sex, which causes STI. So you have certain methodologies in a flow chart to show why you're doing it, but you can't do it by yourself. It must be done collectively. So once you identify your strategies and what you want to accomplish, in any plan, you should have goals. And, goals, we all know what they are. I always believe in that using good goals really helps make sure that you're on track to move forward what the activities that you're going to identify, what the strategy that you're going to identify are going to work. Then you have to have some objectives that go with that goal. And those goals are real, they're measurable, they're SMART goals. They're specific, they're measurable, they're time specific, right? They're reliable. So they gotta be SMART goals, good objectives. They gotta be same thing with the SMART objectives. They gotta show what you're going to do, because the objectives really detailed. The goal is decrease drug use among 14 to 16-year-olds by a certain day. The objective would be, this is how we're going to do that. We're going to really make something to change on this population by a certain time, and this is how we're going to do it. This is how we're going to make it happen. We're going to reduce 14-year-old access to alcohol by developing alternative activities that will allow them to participate in so and so many programs by a certain date. And we will see a decrease by 15% of alcohol use by this population. So they're really specific. And then the activities that go with the objectives are the activities that you're going to identify in your previous specific program. Maybe you're going to do a media marketing thing. Maybe you're going to do a program that talks about the basic aspects of alcohol and what it does to your body. Maybe you're going to do some programs that teach alternatives. And so you don't even talk about alcohol. You just talk about, hey, we're going to do some alternative things that give kids alternatives to not wanting to drink. And then from the goals, the objectives, and the activities come what we call short-term outcomes. Remember I said changing knowledge, changing attitude, and changing behavior. But this is right after you implement your activity. This is what's going to happen. If you do this activity, this is what you expect to see happen by just implementing that activity. The long-term outcome, y'all, is that this is what you expect to see over time if you keep doing it more than once. This is a change in knowledge, change in attitude, and change in behavior. When we had our after-school tutoring program, to reduce drug use. Our short-term outcome was to make sure kids had knowledge about the aspects of drinking and what it could do to their bodies, and how they had a knowledge about it. They had an understanding about it. So change in knowledge, change in attitude, and change in behavior, short term. Long term was to measure if they actually got involved in or were found or caught using alcohol or drug, or definitely said, yes, I've used it. That's a long-term outcome. You go back and you do a survey of those same kids and you ask that question, do you still know about what the dangers of alcohol is, that kind of stuff, and they still have that knowledge base. That's a long-term outcome. Changes in knowledge, changes in attitudes, or changes in behavior. Here's an example of what we would call a process map of goals. You see there's a percentage decrease, objective. This is what we're going to do specifically to impact that goal. Here's the activities that we're going to see happen. We're going to see health, education. We're going to do these 3 things. On the 4th thing, we're going to determine the content of the program. We're going to determine the incentives of the program. We're going to assess who we're going to train around that. Then our short-term goal, our short-term outcome is we hope to see these things happen by them being involved. And our long-term goal is we want to see these things happen by the time, a few years later, that they've accomplished. So goals, the objectives, the strategy that we're going to use based on the research and the data. Is it relevant? Is it realistic? Right? Then what are the activities we're going to use? We're going to do these activities, and here's our short-term goal, and then our long-term goal. Questions? I want to get to a key part in this part about when we're doing the planning process. So after you have developed your goals, your objectives, your activities, your short-term and your long-term, when we, in the SPF process, when we talk about doing strategic planning, you have to ask the question, have you in fact been culturally competent in each part of this process? And that doesn't have to necessarily mean by ethnicity or by particular race, but have you been culturally competent and by all segments of your work based upon your targeted population? Is this process, have we looked at our plan, and is it reflective of the interests of our priority population? Is it reflective of? Does it show that we're trying to impact specifically of the population that we're trying to target? Does it look at, or does it really address any disparity that is at risk of our population? Is it really addressing that issue? And then have we really looked at some of those cultural beliefs and cultural attitudes as we've looked at our plan? Are we inclusive of those things in our plan so we can make sure we're impacting it so for that population to really get it? Or are we just doing it because the population or the group that I come from it's only best from my eye lens? So is it really useful, you all, for the population that I'm trying to serve? Or am I just putting my lens on it and expecting it to work? This happens a lot when adults try to create programs for young folks. They don't think about the interests of they really don't think about the reflectiveness of that population they're trying to serve. And they don't really think about what are some of the impacts that it's impact? What are some of the things that are impacting that population? And then what are some real beliefs for young folks? So if I was going to do a program for young folks, I would have to make sure that my overall plan is culturally competent from both the goals, the objectives, the strategies, and the activities. Because those are critical. Have we taken into effect the things you see there on your screen? The attitudes, the rites of passage, the gender roles, the values, the norms. Have we taken into consideration that we may have to adapt some of the things that we have identified as approaches that we want to use, because what we thought would work and then what we may have to do to adapt to work, is it still evidence? Is it still useful to work? So I always want you to think about it. You create your plan, that you actually think about creating that plan that's going to be useful and fit the puzzle that you're trying to accomplish. Is it that right puzzle piece that you have? The main thing I want you to get out of planning is don't do it alone. Get other people involved. Have a facilitator to help you do it and develop your goals, your strategy, your action steps, but also make sure that whatever activities you identify are evidence-based, have some evidence base behind it,
Sorry, Trisha, I mean to interrupt you. I would love to see that beautiful smile.
Oh, I thought it was on.
There you go.
All right, y'all, forgive me.
That's all right.
Any questions so far about planning? Any comments about planning? Any questions about planning? And although we know we're throwing a lot at you at one time, but this is something that we probably need to talk with Jeremy about doing more specific on it, but I'll let you all decide that if y'all need it. But to me, this is the most, I really get into this because I believe it's the structure of how good we're going to be at working with our population, is having a plan and implementing. That's what I like about the SPF, is that really does help us think the whole process through. And by doing that, it helped me, and it helped a lot of organizations we work with take their budgets, their programs, serving more people effectively, and their budgets both have increased. Not a little bit, but a lot, because they utilize this process. And they do, once they learn it and they get it down, it's like riding a bike. And it really helps too. Let me share the screen. Let's look at step 4. And this one, I'll give a little bit specific attention to certain slides, because I want to also get to the evaluation one, but I don't want to confuse you on the evaluation. Because I want you to get why it's important to do the evaluation, why the SPIF say the evaluation is critical. So we do know that implementation is so important. This is what we've been waiting for, right? Implementing what we want to do. Implementation is what we all want to do as organizations in helping our targeted populations. But as you notice, it is the 4th step and not the 1st step. Implementing is critical. What we want to do is talk about I want to go over some key aspects of implementation. That, you know how to implement, but there's some nuggets I want you to take with you. And so it's, as a part of the framework, the strategic preventive framework, or the SPIF framework, implementation is the next step after planning. But it doesn't happen until after you do the data and who's already doing what, who else can you bring to the table, right? So I call it, it's like navigating when you're ready to implement. So it's like when you're ready to go on a trip, if planning is like a roadmap, so we plan where we want to go, what part of the country we want to drive to, then implementation is really that navigation that I use. I don't know about y'all, but I use it. That GPS on my phone or whatever. It is that turn by turn. Make a right at the stoplight. Da-da-da-da-da. So implementation has to be that specific. It's telling me what it is. It's really taking on what we said we was going to do in the 3rd step of the plan, of planning. But now we're looking at doing the actual action steps to make it happen. And then we're looking at it to be effective. So when we're looking at some of what we call interventions, I call them programs, but in this field, we call it intervention. You need to consider what I said earlier, right? Is it effective? Is it conceptual? And is it practical? All right? So we know also, does it have a cultural fit to it? Because remember, in the SPIF, in the middle, there's sustaining it, and then there's cultural. Excuse me. So when we talk about implementation, we have to ask the question, is there a cultural fit to what we're doing? So I say when y'all see this slide again and get to watch it on your own, I say ask these questions. Have those programs or the intervention that you're going to choose, have they shown some effectiveness in working with population that you're serving? Have they really built capacity to say that, yeah, what we're going to do, we're going to bring our partners involved and they're going to help us implement this. So like what Jeremy's doing, in terms of bringing in the stores to put the vending machines, he's brought in the partners. He's building capacity. He's not saying this is just something for the county. I'm going to bring in the stores so they can help make this happen as well. And then what other subcultures are there in your targeted group that you may need to think about before you implement something in your community? As I said earlier, I gave you an example of what environmental strategies are. This gives you an example of what they are here. So one of the things that I want you to think about when you're getting ready to implement, and what the framework says that we should think about, is that we carry out the various components of what we said we were going to do in our plan. Okay? We're going to identify and try our best to overcome any barriers, because although you may have a plan, you may come across the barrier too. The best laid plans, y'all, don't necessarily mean that it's something that's going to be a barrier that may come up, right? Then you want to also, when you look at your program that you're going to choose or your environmental strategy you're going to use, you want to make sure that we detail how it's going to be implemented. And how you do that, you lay out timelines in your implementation. By this date, we're going to do this. By this date, we're going to do this. By this date, we're going to do this. And then what you also want to look at, how do you keep measuring how the program is effective? Or what I have in that last bullet, is the program have an ongoing, decide on an ongoing program evaluation. Is it effective? I don't know about y'all, but have y'all ever come across any barriers when you're implementing some of your programs? You know, even in a good map that you know where you're going and you have a GPS that you know where you're driving to, there may be a detour that come along the way that even the GPS may not know it. Same thing happens with our program. There may be some things that even though we've mapped it out, we've planned it out, there may be some barriers. And I always like people to think about 3 ways to navigate, 3 phases in navigating implementation. This is a very important slide. This is one of the slides I want y'all to know about. That even before you implement, there's that, what I call that pre-implementation phase. That you know what the characteristics of what you're going to really do. You kind of got an idea what strategy you're going to use. Example, when we decided to use after-school tutoring, we knew we needed to have a process in place to enroll the children into the program. But we also knew that we needed to have the parents' involved with that from the very beginning. So we had to lay out, how will we enroll the young folks into our after-school tutoring program? How will we get parents involved in this? What kind of forms and sheets do we need to have in place to make sure that we have those things there? Okay? How do we make sure we communicate to our schools and to our parents and to our students how this program is going to look and why it's good for them? So during the pre-implementation phase, you really lay out, even before you implement, you lay out what are the things that need to be done in order to implement this strategy, okay? And if it's an evidence-based program, the good thing about it is you'll find out if it's a program like Too Good for Drugs or Bottom Life Skills or Creating Lasting Family Connections or Strengthening Families. They already have a pre-implementation strategy that gets you ready before you implement. That's the good thing about that. But if you're doing something that doesn't have, if you're not using an evidence-based program, but you're using an evidence-based process like we did with after-school tutoring back then, we had to create what needs to be done before we even decide to implement. we chose this strategy. Now we got to do this. The second phase is what we love to do, and that's implementation. We're getting folks involved. We're training our staff. We're making sure that what we're doing is working. We're making adjustments as we go by. We're looking at how we're measuring if we got 30 kids enrolled, only 10 are coming. We're looking at why is that happening. So we're actually doing the implementation. That's the part we all been waiting for all this time. But the unique thing about the framework is it always gets you focused on implementing at this point and not at the very beginning. The third phase of implementation is the maintenance phase. And that is, hey, how do we keep this thing that's working, that's running really good, how do we keep it going to make sure it's effective? Well, you got to do some technical assistance. In other words, you got to call in your teachers, your parents, and your school systems, and who's a part of the program. You got to ask them, what do you think about the program? What things we need to change? What things we need to do better? Talk to our students. What things are good about this program you like? So we're doing some technical assistance, and I usually use the word listening. A good technical assistance is another word for listening. So you listen. And then you also say, what kind of administrative support do we need to keep this going? Oh, we did this program great, and it took this amount of money, and we totally got to make sure that we want to maintain this. We got to make sure there's some resources that are effective that's going to allow us to keep going. So we started the tutoring program in '91. We turned it over to the teachers, to the school district in 2004. So by our maintenance phase came around 1999, and now it's part of the school district in Freeport, Illinois, and still effective. So it was phase 3 of the maintenance piece, and then how are we evaluating, how are we measuring the effectiveness of our program and how effective it can be. Okay. So those are the important phases I want you guys to get. And I also want you to know as this slide shows, at each phase, you can have a barrier that you might come across. The pre-implementation, as I said before, is these. The implementation is doing what we like to do best. And then the maintenance is what we want to do to keep it going since we know that it's working. But in any good program that you do, if it's evidence-based or if it's one that you create, you got to know about the difference between fidelity and adaptation of good program. Fidelity, take a look at this right here. Tell me can somebody unmute their slide and their mic and read this for me? Anybody?
Can you ask your question one more time? I'm sorry.
Can somebody take a look at this slide and read this slide for me?
It's funny. I could read it. And I know it's all mumbo jumbo, but I can.
Tell me what it says.
A study at Cambridge University revealed that the brain can read sentences with mixed up words just fine as long as the first and the last letters of each word are at the correct place.
Very good. Was that who, Siobhan?
Yeah.
All right. Good job, Siobhan. So the reason I did that is it tells you what? It tells you that your brain can read sentences, right? Even if the words are mixed up, as long as what? The beginning and the last word are there, right?
You know how many mixed up text messages we all send and people still understand what we're saying? Same thing.
I love it. So I did this because I want you to consider that if you do implement an evidence-based program like a Bachman's Life Skills, Too Good for Drugs, or any of those things that you get from the University of Colorado, from SAMHSA's website, or from CDC, if you implement them, you got to think about the main core components. It's like you got to think about the core words, the beginning and the end, right? That you were reading up above. You got to know what the main components are. And if you have to talk to the people that develop it, always consult with them, because when you use their program, they will be available to talk to you about it. And then if you do decide to make some adaptations to your program, you need to make sure you write those things down because that's important to know. So when we talk about implementing programs that you want to implement it with fidelity. And what that means is that you implement it just the way the directions say. Now, I know what I like about my mama, she had her own recipe for sweet potato pie and for dressing for Thanksgiving. Now, she had it, she said, you do it this way, this way, this way, this way. Now, if I try to do it any other way and adapt it, it will not come out the way my mama made her sweet potato pie or her dress. When I think about programs, I think about it in that vein. If you decide to say you're going to do your program this way, you're going to implement it with fidelity. It is the actual way the program is supposed to be done. But if you adapt it, you can adapt certain things as long as you don't take away the core elements of that. Now, if example is, if I decide to do my mom's sweet potato pie and decide to use apple, but use everything else the way she said it, it won't be a sweet potato pie, right? So that's not adaptation. If I decide to adapt, and she said use a 15-inch pan, and I decide to do a 10-inch pan, I have adapted it, right? But I kept the fidelity as to how to make the pie. So adaptation is meaning that I kept the core elements on how I made my mama's sweet potato pie. I just changed the size of what the pie gonna be in. But she said in her instructions, do it with a 15-inch pie pan. I decided to do it with a 10-inch pie pan because it's just for me only. So that's why when we talk about programming, when you do fidelity and adaptation, if the program says you do it this way, this many days, this many weeks, that's keeping the fidelity, and you probably will get the result of what you've done. But if you adapt it and you don't keep up some of those core elements of that program, then you won't get the same thing that you should have got. Okay? Here's some 6 guidelines I wanted you to understand when we talk about fidelity adaptation. Always identify and understand what's behind that program and what you're trying to accomplish, what that theory, what you're trying to accomplish. Always locate what those core elements are, as I said earlier. What are those core elements of this program? And how do I make sure I keep those in it? Always assess how you're changing it or how you're keeping it as you do it when you implement. Consult with somebody who developed the program or with an expert that knows about the program as you're thinking about doing some changes. And then consult with the community in which you're taking the implementation to. So in other words, you come to the community like, nah, this program is supposed to happen for 15 weeks. You better switch that up to 6 weeks. And we ain't coming. So now you got to take some of those core elements, and instead of putting it in 15 weeks, you got to put it in 6 weeks. And then you got to develop an overall implementation plan. So always consider the cultural competence of the implementation of your program. Always consider that, hey, if you're doing it in mostly or majority or large population that's English being a problem, you might have to change it and switch it to put it in the language that's appropriate. Or if it's only for certain populations or individuals or genders, you might have to think about that, right? You want to think about how you implement it because you want to make sure that it is a culturally fit project and you're not just thinking that out of your lens on how to implement this program. That's one of the key things I want to leave you with implementation. You always want to make sure what did work when you implemented that project, you want to keep that around because that's what keeps programs going. And always remember that no matter what you do with implementation, you got to do a pre-phase, you got to do a post, or what we call a maintenance phase of implementation. What you do is setting the program up, what you gonna implement it. Yes, that's the fun part about it, because we were ready to implement from the very beginning, but we're following this process, and then we're trying to maintain what was effective that we implement. And that's really important. So the last phase I want to go through is evaluation on this framework. The evaluation process of the SPF, of the Strategic Prevention Framework, really asks you to evaluate, to measure, to make sure your programs are being effective. Okay? And evaluation of the SPF, even though we said we did assessment, we did capacity, we did planning, we did evaluation, implementation, now we're doing evaluation. Look at this cartoon. So you say your program works, but why should I believe you? Imagine the funder, whoever it is, telling you that, asking you that. Why should I believe that your program works? You know, because what, the hairs on the back of your neck make you feel good? You had a warm feeling? No, this person says, I know my program worked because I have what? Evidence. Evidence that it worked, right? That's why evaluation is clearly important. So when you're thinking about doing some sort of evaluation, you want to include an evaluator as early as possible. And you want to differentiate steps that inform one from another. You want to make sure that cultural competence is involved in this process and that the things you found that you measured worked. Now, let me say this to y'all. When we did our after-school tutoring program, we were blessed to have an evaluator who were looking at doing prevention and how after-school programs connect with substance misuse prevention. We were blessed to do that. But when we had to do another program, we had to go to the university Department of Sociology or Psychology, and they had people for free that can help evaluate your programs for you at no cost. Okay? But getting an evaluation to measure what I call a third-party evaluation, to measure your effectiveness is so important. Why do I say it's important? A third-party evaluation is like having a third-party auditor. Your organization may have a CFO, may have an accountant, may have a bookkeeper, but having a third party or an auditor come in and audit the financial process assures that what they're measuring cannot be subjective. So like an auditor who does an audit will not be subjective to, ooh, I like your organization, so I'm going to tell you the good things about it. Same thing about a third-party evaluation. They help you see the good, the bad, and the ugly. So having a third-party evaluator is good for your program, y'all. And you can get them for free. You can get them for free. Evaluation is more than a final step. It should be part of every part and aspect of what we're doing with the Strategic Prevention Framework. So we should be having our evaluator measure what we did during our assessment phase, measure what we're doing during our capacity building stage, measure what we're doing during our planning stage, measure what we're doing in our implementation stage, measure what we're doing around our cultural competence, measure what we're doing around sustainability piece. The evaluation should be seen as the final step. It is a step that challenges how successful we are of implementing our good program. Because not you saying that your program is good is not good enough. Showing the evidence that it's good is what brings the validity and opportunity for more funding. We took our program for our after-school tutoring from a mere 45 kids a day. And because of evaluation, we were doing 12 to 1,500 kids a day. And we were able to show the changes in knowledge, changes in attitude, and changes in behavior, the outcomes, if you will, because they challenged us to do what's right for our program. So evaluation is critical. It's really a collection and analysis of good information about your programs. It really helps set the stage. It's not the final step, but it's really about helping you to improve the effectiveness of your program, what you're trying to accomplish. Evaluation is very different, y'all, from research. We're not talking about research. We're not talking about all the scientific stuff that needs to happen. We're clearly talking about just measuring and the merit of the work that you do in your program. Measuring the effectiveness and the decision-making on how you got to one decision or another. Measuring how things are changing, how things are different. Measuring what worked and what didn't work and why. Measuring from all views. This is not research. It's just telling you how well you measured your program. Take a look at this. Review the monitoring data. Why bother? We're going fine. Really. If that's the project, and the lady and the person and the evaluator tells the project, oh, we ain't got to worry about monitoring our data. Oh, we're doing it just fine. But look what you're about to hit. That's why good evaluation really keeps your program from the dangers of things that shouldn't happen. Good evaluation helps you make adjustments when you need to. But there's two types of evaluation I want you to understand. It's the process evaluation and it's the outcome evaluation. Two different types, y'all. The process evaluation, that's like this. We said that we're going to have 100 kids in our after-school tutoring program a day for first through fourth grade. We said in our one class, we're going to have 25 kids in our after-school, in this one class, 25 kids in this one program. They said they signed up and everything. We got 25 kids enrolled in our program. So when they come, they do a sign-in sheet. We talked about these things while they were there. So now we measure what we talked about and how many people showed up. That's process evaluation. That's process. What we talked about and how many people came. It doesn't measure the behavior change, just measure the process. Just measure, we said we're going to have 30 to 25 kids come to that class. We're going to do these activities. Was these activities done? And did we have 25 people? That's process evaluation. Outcome evaluation is, we said we're going to do these things. We said 25 out of 25 kids are going to come, and we're going to look for if they have a change in knowledge, a change in attitude, or a change in behavior. That's outcome evaluation. Two different. We should do both. You should do both. You should do process evaluation, outcome evaluation. Okay? Process evaluation and outcome evaluation. Here's, like I said before, we look at numbers, who came, how many people came. It's all about who came and what you say you're going to do. That's process. Outcome is, did we see a change in knowledge? See that? Did we see a change in attitude? Did we see a change in behavior? That's process, okay? That's process. But always what this good evaluation helps you tell your story about your program. We were able to tell our story and go from 43 kids to 1,500 kids a day, from a small budgeted program to a 6-figure program for after-school tutoring. The evaluation helped us tell our story. What was the successes? What was the challenges? And what lessons that we learned? And the more you get that evaluation in your program, the stronger your program and what you do will be more realized and validated. It's so important to get your stakeholders involved. Keep your stakeholders involved, your partners. That's how we grew. Our stakeholders were our school, was our parents, was our students, was our teachers, was our community members. Getting them involved, telling them the story of what the results of our program was. I know you think it's about, you don't want folks in your organization's business, but you can control what you want folks in your organization's business about. And you follow your logic model. Keep it, follow it. It's part of your evaluation. It tells you what you're going to measure. Okay? As you said before, we talked about the if-then. If we have these resources, then we'll do these activities, then we'll implement these, then we'll get these outcomes, these outputs, and then we'll get these outcomes. Good logic model evaluation. You're going to have qualitative evaluation, quantitative evaluation, or surveys. They're a mixture of both. But always understand the cultural competence and linguistics of what you do. Now, if you have an evaluation And that's the tool. But there's a problem with the nut. No, there's not a problem with the nut. It's a problem with the tool. If you're trying to measure something, you're measuring what you need to measure and make sure the tool matches what you're trying to measure. So as you work with those free evaluators from those universities, like the Medical College of Wisconsin or UW, Milwaukee, or Marquette, you're measuring with folks who are doing evaluation. Make sure they create the tool that you're trying to measure. Not you trying to fit your program into their tool. Okay? Always know it's always good to, as you work with that evaluator, the evaluator supports the work of the program, not you listening to them and they control the program. They're trying to build, it's about relationships, and they are trying to work to support the program. An evaluator does not have what I call bossy pants. That's what the American Evaluation Association, AEA, says bossy pants. They say we are experts in evaluation, but our clients are what? The experts in the work that they do. Taking a non-expert stance requires a shift in our practice towards asking the right questions. Their own agenda as evaluators, questions and solutions need to be secondary to helping you all out define what your questions are, what you want to see as solutions, and how you want to build to see change take place. Because in the end, the evaluator knows that their clients are the ones who have to do the hard work of change. And this came from the American Evaluation Association. They realize they're not the boss. And I'll leave you with some resources here that you can look up, but I tell you, local colleges and universities, to me, are your best free source to use. Because then they can take the information that they collected and they can move it forward. So here's another I wanted to show you was this one. When they said infographic, do you think they wanted something shorter than our usual 200-page report? That's crazy, right? Who wants to do all that? A good dissemination of the project is important. And then here's another one. I just put our long, boring report up on a buried web page in a format that requires it to be downloaded. Yet for some reason, nobody's reading it. I wonder why. The evaluation is so important to the work that you do and how you do it. Your evaluator helps you tell that story. And you're sustaining it in every way that you can. You're trying to be sustainable in every way. And so sadly, as this says, this was our evaluation funding. This was when our evaluation funding dried up. Why? Because they didn't do a good evaluation. So there's no right way or wrong. There's no one right way to do an evaluation. You start early with your evaluations, and really documentation is the key. And then this is important as well. Take a look at that. Oops. She collects data and it will help us remember what we said we were going to do in the first place. So I leave you with saying thank you with this opportunity. It is 3:00, but I do want you to think about and type on the text what you either liked, what you either learned, or what you want to know more about, or what you were disappointed about. Type that in the text. I'll stay on for a few extra minutes, but I want to thank you for this opportunity to give you the last 3 phases of what the strategic prevention framework is all about. Do I expect you to learn it all in these last 2 weeks? No way. Do I expect that you hopefully got some kernels, some ahas out of it? Yes, and I hope you want to dig a little deeper and to learn how the strategic prevention framework really works. So I thank you again. Have a wonderful week. And don't forget to do the evaluation, but also feel free to tell us what you learned, hope that you wanted to see, what you was disappointed about. Tasha or Jeremy?
Thank you. Thanks, Tracy. Another great training. Jeremy's gonna hopefully come on and he wanna close out, but we will follow up with anyone who followed up with us or reached out to us through the chat or any type of follow-up. So you will be looking for an email from me. And thank you guys so much for the post-evaluation that we dropped in the link. Really does help. And it kind of speaks to what Tracy was talking about evaluating what you do as process evaluation. So the next thing that we do for you wonderful people, we would have read your evaluation and either made some adaptations or keep going as we will. So thank you guys so much. And I appreciate it. Again, great training, Tracy. Jeremy? All right. So we will stay on if those have any questions. If not, thank you guys. You can drop off and we will see you later. And Ms. Kyle, I will be reaching out to you.
Thanks, Bernadette. Thank you.